delighted to welcome all of you to this conversation around staff engagement. Um, I'm really, really passionate about it and have been for a long time. And um, it's great that so many of you are interested in finding out more about it as well, and hopefully sharing your insights and your wisdom around engagement and what it means. So I'm Jade. I'm one of the OD consultants at South Central and West, and I'm joined by my OD consultant colleagues, Colette and Amy. And I think we've got a couple of other SCW colleagues on the call as well as participants, which is fantastic. So for those of you that don't know anything about South Central and West, so we're a commissioning support unit. And that means historically and currently we were set up to provide support services into the commissioning process. So we are an NHS organisation, but we operate quite independently, which is fantastic. And actually, over the last few years, we've shifted hugely in how we support organisations, the things that we support them with, and the types of organisations as well. So we still provide lots of support to ICBs and ICSs, but providers as well, and other health and care organisations. So we do a lot of work around staff engagement and helping organisations to not just interpret their results, but to kind of really drill down into the data and make it meaningful. And we do that through facilitated conversations and workshops and lots of other ways as well. But we wanted to put this session on today, I suppose, because staff engagement is a topic we're probably all aware of and familiar with, and we recognise it, as a core pillar of what makes up a healthy, effective organisation. So I think when you work in OD, particularly, you hear about staff engagement a lot, and you start to recognise the importance that it has on organisations and all facets of the organisation as well. So we spend a lot of time talking about it. We're passionate about it. But we do recognise as well that it's a massive topic, and Catherine just mentioned one area that we might not cover today, but we absolutely could in the future. So hopefully this will be the first of a few sessions where we can delve into different aspects of staff engagement. But today we're going to talk a little bit about what is it, how do we describe it, why is it important? And then we'll break out and have some discussion, because hopefully that's the interesting bit rather than us just chatting at you for an hour. And then we'll finish off by giving you some practical tools to help you, hopefully, with some of your staff engagement activity. So hopefully that sounds like a good use of time. I'm going to hand over to Amy now, and she's going to talk to you a bit about what it is.
Perfect. Thanks, Jade. Can everyone, I'm hoping you can hear me, because I don't usually use
Yes,
a
we
headset,
can hear you.
just blocking out potential dog howling and squealing. So yeah, what is it? So we're going to start talking about this, but a bit of a cheat, really. We want to get you engaged right from the beginning. So we want you to kind of tell us your understanding of what staff engagement or employee engagement is from your perspective. So we're going to use Mentimeter, which I think hopefully most of you have seen the email from Jade yesterday or the day before saying just a bit of a heads up we were going to use it. And Colette's just helpfully put in, so it's menti.com. You can navigate to that through either if you're using a laptop or if you're using a phone, and then put in the code that again Colette's put in the chat. And then we just want you to answer this question for us if you can. So how would you describe staff engagement? So it can be one word, it can be a short phrase. I think there's a limit on the characters you can use to your answer, but as you answer they will start popping up on screen, so we'll get a bit of a live response. Oh, listening, nice and big, fantastic. Feedback, great. I think hopefully is it multiple answers you can put in there? I'm looking at Jade.
It is.
To nod.
It
Good.
is.
That's
Yeah,
good.
I'm just checking.
Excellent. Cool. So we've got connection, listening, feedback. So with Menti, the more, if people put in the same word, it comes up bigger in this word cloud. So it's good to see that. Any more for any more?
Oh, there you go. They're all
Here we
starting to appear
go.
now.
Yeah,
Lovely.
here we go. Good. Thought-provoking.
Mm.
I like that. Supportive, proactive, participation, good, connection. So there's obviously a theme coming through: participation, connection. I like that listening is there in the middle as the biggest one as well. Community, Here we go, more buy-in, empowerment, perfect giving. Oh, I like that one. There's so many things I want to ask people more questions about, but again, we're conscious of time. Varied involvement, thought-provoking, good. Amazing, good. So we've got quite a breadth of stuff there. I think there's a good theme coming through in terms of we've got that connection, that feedback, collaboration, community. I like that. Empowerment, I really like that one. That's a good one. Two-way. Awesome, good. So we've obviously got feedback. So feedback, buying and listening are kind of coming through as the bigger ones there. So that's obviously ones that more than one person has put in, which is fantastic. Good. Awesome. I think we're going to move on from that one. That's really good. Thank you for your comments on that. So it's really good to see that kind of breadth of what people's thoughts are around engagement, because I think it's probably, and reason why you're probably here, quite a kind of hot topic and sometimes maybe a bit misunderstood or a bit grey, a bit mystifying. So we've kind of had a bit of time to research this, and obviously, like Jade said, it's something we are passionate about in the OD team. So sometimes staff engagement gets kind of bundled in with what we call staff satisfaction, but actually there is a separation there between what we mean by staff satisfaction and what we mean by staff engagement. So on the slide there you can see Gallup, so which is kind of quite widely recognised. They do a lot of work around this. They do a big worldwide kind of global survey as well around employee engagement, and they define it as involvement and enthusiasm of employees in their work in the workplace. Again, that's quite hard to kind of pinpoint and define, what's enthusiastic, what do we mean by that? But when we look at it in terms of actually what we might mean by staff satisfaction, so satisfaction might be actually how are our expectations met around our kind of pay and our salary, recognition in the organisation, career development, atmosphere, what the reward is like, what our relationships are like. That's all kind of bundled around how satisfied we are, how content we are with the workplace. So are our expectations around all those kind of things met, or are they not? Are we happy with our work? But actually that satisfaction piece, although it's part and parcel of staff engagement, it's not the holistic picture that we would say staff engagement is. So it's part of it, but it's not the whole piece. So an article by Forbes actually said that happy employees are different from engaged employees. So there is a piece of that in there, but it's not the whole picture. So we'd actually say that staff engagement is all of those kind of satisfiers that we were speaking about, but also then on top of that, it's the behaviors, the attitude, your approach to work. It's a lot more of that under the surface. So motivation, for example, are you or are the staff motivated by the organisation's vision, values, their own objectives? Do they have an interest in that? Are they enthusiastic about it? Are they involved and committed? Do they have a sense of purpose? So is there a connection there to potentially, something bigger than just their kind of day-to-day job? So we're going to ask you again this time. So if that is what staff engagement is, so it's this quite kind of big mammoth thing, why does staff engagement matter? So again, we're going to go back to Menti and throw this out to you again. So hopefully you should be, if you've already got the page up still, you should see the second question now. So why is staff engagement so important, especially in the NHS right now? So all those things we just spoke about in terms of not just the satisfiers, but the motivation, the connection to a purpose, the commitment, the involvement. Why is that so important for us in the NHS right now? So we've already got some things coming up. Retention, yes. Improved outcomes, yes, definitely. Morale, huge one, yeah. Any more? They're coming through. It's good to get a nice visual like this, isn't it?
It is indeed. We'll share this afterwards so people will be
Yeah.
able to see it.
And if you haven't used Menti before, hopefully this gives a little insight. So patient impact, absolutely, yes. Influencing change. So we've still got retention and morale as two of the big ones coming through. Motivation, yeah. Influencing change, belonging, having a voice, losing great people. So yeah, it's why is it important? And also, yeah, what are the risks there, I suppose, if engagement isn't there? Expectations have changed, yeah, lots of stuff around change being included, innovation, sense of purpose. Absolutely. Love it. I'm just gonna, is there any more? I think all those things are very relevant to what we're going to look at in just a second. New ideas, innovation, retention. Yeah, perfect. Excellent. So yeah, we're going to move on now to have a look actually why staff engagement is so important. So I'm going to throw the baton back to yourself, Jade, so you can kind of go through what some of the research is telling us.
Absolutely. And I think, to be honest, a lot of it you've covered off beautifully already, which is fantastic. So some of this, I'm sure, won't be a surprise. Some of it might be. Might be a scary surprise when you look at some of the stats around staff engagement, particularly within the UK. You know, one of the great things about staff engagement is it's really well researched. So and it's a growing field. So there's loads of data out there, which is really useful. And there's a growing body of evidence that tells us just how impactful and important it is as well. So that's a good place to be, that we're learning more and more about it and the effect that it has on organisations. So what we do know is that people who feel part of a team, so authentically feel part of a team and understand how they contribute to that team, will be significantly more engaged. We know that leaders and managers have a significant impact on how engaged their teams and their employees are. One of the concerns is that managers and leaders aren't particularly engaged in work. There are large chunks of the leadership population who aren't engaged, so that clearly will have a cascade effect on other staff. We also know that having a sense of purpose and really understanding how you contribute to the organisation is one of the biggest positive impacts on how engaged you feel within an organisation. So yeah, Gallup, as Amy said, they did a survey. They do a survey every year. It's a global report. It's absolutely massive. It surveys thousands of people across the globe, and it's really fascinating. So I will pop that in the email that comes out to you afterwards. But it did show us, worryingly, that it was certainly in Europe, we're one of the lowest engaged workforces, at 9% engaged. Now, actually, within public sector organisations, we actually come in a bit higher than private organisations, and you could probably imagine why that is. And actually, when you look at things like the context of COVID, not everywhere, but engagement did go up or sustain across a lot of areas, across a lot of the metrics. So it does tell us that engagement it's psychological and it's actually quite complex. But the impact that it can have when employees aren't engaged is profound, as you can see on there. So it costs, they estimate it costs the UK about £340 billion a year in lost revenue, lost time, sickness, recruitment. All of that has a massive impact on organisations. And also, when we look at that from an NHS perspective, you know, all of us who know and love Michael West will know that he's done lots and lots of work around this and has been talking about engagement within the NHS for many, many years. You know, and we're very fortunate that we have Staff Survey that was born over 20 years ago, because as health and care organisations, we recognise the role that it has and you know how important it is to understand it. Michael West's work has proven that it shows that we can have better retention. It results in less sickness and lower turnover when staff are more engaged. There are more compassionate and caring cultures. We deliver better care and we reduce the risk of patient mortality. You know, he has made that direct link between staff engagement and patient mortality. He's also more recently looked at the link and the correlation between staff engagement and agency spend and bank spend. And again, you know, it's really clear that it's having an impact on all facets of organisations. You know, money, recruitment, retention, sickness, well-being of staff. It really touches all of those points. If anyone hasn't seen those, again, I'll send you the links to those so that you can have a look. So so we know that there's lots of engagement data out there. We use it. If you work for an NHS organisation, which I think all of us do that are on the call, or I think Catherine's part of a charity, but we have data at our fingertips, and we've had that for over 20 years. The NHS survey is one of the largest in the world, so over 600,000 people take part in it each year. And staff engagement, it starts with feedback, and we can't engage without it. Apologies. So it's really important that we are getting that insight, we're getting that data, and actually staff survey gives us some really great clues about what's happening within our organisations. But actually, when you look at data at a high level, which is typically where we would be getting our staff survey data at, organisational level, perhaps service level, divisional level. Actually, when you look at it and you do comparisons, there's not a lot of difference. So you would typically see less than 10% variance of data in the data when you look at it at those levels. So yes, it gives us clues, but it doesn't necessarily tell us about the context in which people are operating, and it really doesn't give us that sort of richness of and that meaningful data that you're only going to get when you talk to people, which I think links back to the things that you shared around feedback, conversation, discussion, listening. All of that is absolutely key to turning that kind of insight into action. And where you get the real richness is when you start to drill down into team level. So when I worked for an NHS trust up until fairly recently for a number of years, and we would get our staff survey data, and it was helpful and it helped us to action plan. But actually, when we created an internal tool to start drilling down to team level, that's when we really started to understand the impact of staff engagement and the variance that was happening across the organisation. So we had teams that were coming in at 85% engaged, because we would quantify the scores, and that's fantastic. But we had teams in the same organisation coming in at 35% engaged. So they work for the same organisation, but they're having wildly different experiences. So I think it serves as such a good starting point, but actually it's about how do we then harness that to have some really great conversations. And as we've seen, leaders and managers play a massive part in that, making sure that that happens and that people have the space to give feedback. Before I pass over to Colette for just to break us out, does anyone have anything they'd like to share about the last couple of slides? Any sort of comments or reflections at all?
Jade, there's a question in the chat around, is the survey broken down by sector to be able to compare with the NHS Staff Survey, which has engagement measures?
Yeah, if you mean by sector, do you mean, Zach, because it is broken down by organisational type? Is that what you mean?
Yeah, so this is going back not obviously to the NHS Staff Survey, but the global survey. So could you, for
Oh, I
example,
see.
compare?
Yeah.
Could you compare, healthcare in the UK with healthcare somewhere else to see actually are we facing the same engagement issues internationally, or are we better or worse in the UK? But also, are they, better or worse in manufacturing, tech, or healthcare?
Yeah.
So it's just
Yeah.
that kind of comparison.
I don't think Gallup does. It might do, but one that does have the breakdown between, certainly between public sector and, I think they called it essential workers and non-essential workers actually, but I'll double check. But the Engage for Success, which we'll talk about at the end, but Engage for Success are they are absolutely fantastic. They were a government initiative set up many years ago to improve staff engagement within the UK. So they're a voluntary organisation. They get support from hundreds of different people across many sectors. They did an engagement report with it in 2022, so it was kind of post-pandemic, and they certainly started to break out the data between public sector and non-public sector. So that might give some indicators as well. Absolutely.
Great, thank you.
Has anyone else got any sort of reflections before we move on? Any surprises? is that people sort of recognizing that that's how it's feeling? Does anyone actually go down to team level and have those sort of formally and have those conversations? Lou?
Yeah. So obviously, I'm in CW anyway, so I'm in the DDAP directorate. So my role has just kind of is evolving over the next week or so, and that I am now going to be business manager for people quality and improvement. So we're working already with lots of our HR colleagues,
Fantastic.
Stacey, James Jackson, etc., around staff engagement. So we have missions at the moment where this work is going to be really valuable. So I get the staff survey data, and that is forming part of our conversations around how we can get a more engaged workforce. And it goes into all sorts of things. It's a massive transformational program around training and all those kind of things, but this will be really insightful. So all of these key bits of information will help me pull it together so that I can help promote and link with you guys, and maybe do a lunch and learn or something for our team that I can put in our repository. Would be really handy.
Absolutely. No, pleasure. Congrats on the new role.
Thank you.
So I'll pass you over to Colette and we'll move you into the next part of the session. So over to you, Colette, and I'll just move the slide along for you as well. There we go.
Thank you. So this is your opportunity to speak and to share your challenges, wins, successes, questions with each other. So what we're going to do is put you into breakout rooms and ask for you to discuss 2 questions. First of all, what challenges are you facing for improving staff engagement? I know Catherine mentioned one right at the beginning before others had joined around the continuous staff engagement once you've got the data back from a survey. And the second part of the discussion is, how could you overcome these? Have you got any thoughts? And also, do you have any practical examples you can share? We're conscious of time, so we're going to give you 14 minutes once you've gone into your breakout room to discuss these 2. So practically you could split it in half and have 7 minutes per question, but that's up to you how you want to manage it. And what we'd like is, when you come back, is for each group to share 1 key point in answer to both questions. So 1 answer to each question when you come back, just so we can get a sense of what you've discussed and your most popular conversation there. So hopefully that will help you and others in the group. So Ren is going to very kindly put us into breakout rooms. We might come in with you. If we do, we'll just check everyone's there, you're all okay, and then we'll leave you to it. And we'll set the clock once we're in there. So Ren, do you want to go ahead and set the breakout rooms for us, please?
Okay, I'm opening up the room.
Welcome back, everyone. I hope the discussions went well, probably very quick, and were also useful. Could we have from breakout room 1 point to answer the first question, please?
Ren,
I don't think people will know. Yeah.
Ren might
I
have
can't remember which number.
Ren, are you able to tell us, if you have a little look at the rooms, you might be able to tell us who was in what room? Give her a motor. Can you see?
I can. Okay.
Excellent.
Room 1, we had Diane Walsh, Harry Adams, Julie White, Sean Michael Simple, Athena Jones, and Catherine Munsden.
Perfect.
So could someone from that group share a key point to answer question 1 and 1 to answer question 2?
So I can, so somebody mentioned that when we do the annual surveys for staff engagement, it can be quite after the fact when you receive the results, which isn't always helpful. And then a thought about how to overcome this would be to potentially have monthly surveys as well, so that you're getting the information at the time.
So you feel that the survey data isn't very timely when it comes back. Was that the
Yeah.
first point? And have more regular surveys to overcome that.
Mhm.
Okay, thank you. We didn't have a room 2, so we have
Yeah.
room 3. Who was in room 3? Does anyone know? And if not,
Oh, that
can
might have been it might have been us actually.
It was Jade. It was yourself,
Yeah.
Nicola.
Okay, gonna hand over to Calais.
Yeah, so I was discussing one of the challenges that we've had in our organisation with improving staff engagement is, well, personally, in my role, I work internally for the BNSS GICB, but also externally with system partners. And a big task we had was improving staff networks. And one of the things that we're really struggling with was actually the engagement from system-wide comms to get out the questions we need to as many people as possible. And the difficulty that I found is that if it didn't seem like it was the buzzword of the moment, there wasn't a people didn't want to engage in that because there was something else that was going on. I mean, now a big word is belonging, and so now everybody's all about, yes, we need to find out those things, but when we were trying to do it, it was a year ago, and now we're in a stage where we haven't got the right kind of measurements that we need because we just couldn't get the engagement through the comms to get the right channels in, and it was finding the hook that we needed to get in, and we very much had to rely on people that we knew in each organisation to be able to promote that, which is
Right.
It's a difficult task because it's just time consuming.
And how would you overcome that? Or is there another example of how you'd overcome challenges?
I've got another
So-
example from Jolie.
Yeah, so we spoke about what we currently do at the Isle of Wight NHS Trust. We've just recently introduced events called Trailblazers, where we get we split them into different division sessions, so planned and unplanned and stuff like that within our trust. And we go through all of the heads of the departments, we invite them all along and we go through all of their staff survey results, and we encourage group discussion and staff discussion to create actions off the back of it so that they can share best practice, share what they're doing with it, and come up with actions to pass down to and filter down to all of their team. Because one of our struggles is that we are not hitting that team level of engagement. So it's how do we get it down? So we're trying at the moment to use that to filter the results down. And we've recently started introducing quality improvement methodology into the trailblazing events. So we have our QI lead to come and speak and introduce all of the tools that they work with, such as fishbones and drive diagrams. So utilising all of the improvement tools within quality improvement to see if that can be used at a team level or department level as well.
That's great, thank you.
Fantastic.
Really helpful. Okay. And room 4, what were the challenges you faced for improving staff engagement?
In room 4, it was Louise, Zach, and Lou, and Ben Cook.
I was gonna say, I was assuming it was us. So we talked about that you can have a fantastic EMT, which we were very lucky to have at SCW, and really clearly defined values, but a great SLT, particularly in the directorate that you sit in. But if your experience on a day-to-day basis in your subspecialism within your directorate is poor, or your experience is that your line management is, you're not getting the things that you need, then that's a very different experience. You can keep hearing those corporate organisational messages, or even across from your own SLT, but actually if your experience is very different, then those are the kind of challenges that we're facing. So to overcome these, we've had the couple of people that we had in our group were or had worked for SCW, so we kind of talked about it in our own context, where we talked about that, you need to temperature check, you need to have those listening exercises, and try and bring people along on the journey. So we talked about that, people may not necessarily still like the final decision, the final business decision that's been taken, but actually if you feel genuinely listened to and that your contribution has been considered, in the most part, people will say, okay, well, I still don't believe that's necessarily the right way to go, but you know what, I'll go with it. And there is only so much. I think there has to be an acceptance as well that there is only, whilst we all strive to convert everybody and to bring everybody around to the the ways of thinking it to support those business decisions, that actually, it's not possible. And sometimes there has to be an acceptance that, after all those things are said and done, if you're still not able to bring those people along, then that's a choice for them, and you can help them, with moving on, or you can help them, develop so that they can move into a better space for them. And we're fortunate where I am, particularly because we've got a particular transformational piece of work with Fit for the Future going on, where mission 2 is around people, and that's the stuff that I'm working on with colleagues to kind of bring those improvements. So that's where we get to now.
Okay, thank you very much. So as I say, hopefully you found the conversations useful, and obviously we could talk a lot more about this. It's a huge topic, and there's lots of challenges and lots of ways of overcoming it. So one thing we'd like to understand is, obviously we've only had an hour today, is for you to let us know if there are any future topics you'd like us to discuss. It may be challenges you want to overcome, it may be sharing good practice, it may be sharing some insights you've had from your organisation or externally. So anything that you really want us to address, we're very happy to consider, because we recognise, as I say, this is a huge topic and we've only just touched the surface of it here. And also we wanted to provide some tools to help you get started on this journey. It's not necessarily I know you're not necessarily at the beginning, but it might just help your thinking about where you're at now with staff engagement. So as Jade mentioned earlier, Engage for Success is a great resource, and they actually have a number of surveys that you can use for free at a team level, which might help you get to a deeper level of the organisation to understand what's really going on and start that conversation. So we'll send those links out to you. And also we can offer support from SCW in terms of what you need to get started. In the OD team and across the team, other teams in SCW, we can help you analyse your results, work out a plan of action in terms of how you want to have the conversation going forwards with those teams to really get to understand what the context is, what the story is behind the results. We can help you run focus groups, we can run interviews for you, and that just helps give an objective view of what's happening, rather than often internal OD teams don't want to work on it because they're also part of the system or part of the culture. So sometimes it's helpful for someone else to come in and do that for you. And we can certainly look at gathering those insights and feeding them back to you. But obviously there, it would mean the people in the organisation need to discuss and agree the actions to take forward, because they've got to take ownership of them. Do you have any questions on that in terms of what is available to you? No? Jade and Amy, do you have anything you wanted to add to that last piece? There's masses of resources out there. I just wanted to say we've just picked out a couple, and obviously we need to share what we offer as well. We couldn't leave you without saying that.
Yeah, I was only going to say about
Diane, you've got your hand up.
Oh yeah,
sorry.
Go for it, Diane. No, it's fine.
Yeah, it's just a suggestion when you said about, what else would be needed or could be needed.
Yes, please.
I think the thing that's really useful is the research and the stats, so that we don't all scurry off and try and investigate everything ourselves. And, that's 20, 40, however many people are doing that.
Yeah.
We're all within our individual organisations, I would imagine, trying to get people to listen to the key messages. And they're either going to listen because ethically it just sounds like the right thing to do or sounds like common sense. But for some people, they'll only listen to the stats and so anything that helps the cause with the money savings, the ridiculousness of what you lose in productivity, all of those kind of things. that for me would be really useful if you were able to, you know, if you had another session, that's the sort of thing, if you were applying us with that, I think could be really useful for us all to onwardly use.
Okay, that's really useful. Thank you so much for that suggestion. Does anyone else have any suggestions right now? Okay.
I was going to say, definitely, Diane, such a great point, and linking, you know, as Michael West has done so beautifully, but, you know, linking any of this to outcomes is where it can be really, really powerful. And that is absolutely what will resonate with people, is the impact that will, you know, that will come from either low engagement or high engagement, because the data is there and it's solid. And we're very fortunate in the NHS. There is, you know, we've had that 20 years to really get under the skin of our engagement data, and we can really draw some brilliant kind of conclusions from that. And, you know, the King's Fund and Michael West and Engage for Success, they're all organisations and people that are kind of flying the flag for it. So it's definitely there. But yeah, absolutely. And I was only going to say about those team tools, do have a look at them, because if you are interested in kind of drilling it down to team level, so teams can be really clear on what are the 1 or 2 key things that I could prioritize right now that will make the difference. It's tools like that, or obviously, if you know, we can help facilitate that as well. But it's having those conversations, whether you do that through a diagnostic or you do that through, you know, holding space and holding conversations. That is where you will get the intel that really matters. But it does take good leadership and good management skill to be able to hold those conversations and be vulnerable to hear that feedback. You know, as a manager, we had all of that at Southern Health. When we started to go down to team level, we had managers that felt very worried, very anxious, you know, very vulnerable, because suddenly they were seeing data that felt very personal. So there's something about making sure that managers, you know, because they are absolutely your you know, your enablers, it's making sure that they feel psychologically safe and equipped to be able to have those conversations.
Yeah.
Because, you know, there's always risk associated with getting feedback and managing those really powerful conversations. So if your managers can do it, excellent. If you can equip them to do it, even better. But that's where sometimes it can help to have other people come in and do that with you as well.
So thank you so much, everyone, for your time today. It did fly by. We did worry about how much we could fit in a small piece of time, and appreciate it's over lunch as well. We will make sure you get all the slides from today, including the Menti outputs, a recording of this session, the Gallup survey, the Engage for Success links, if I can say that. And also, we'd like to send you a feedback form, really just to hear your thoughts on how it went today. And once you've had time to reflect, if there's any other topics you want us to cover. And one final thing is that we will run this as an internal lunch and learn session for SCW at some point as well. So thank you so much for attending. We really appreciate it, and hope you got a couple of learnings out from it, and maybe some new contacts as well.